Hello and welcome to this live Q&A from the World Health Organization. The topic today is how to care for someone at home who has COVID-19. My name is Nika Alexander. I'm part of the communications team here at WHO. We're coming to you from Geneva, WHO's headquarters. And I'm joined today, our expert today is Dr. Janet Diaz. She's the clinical care lead for the World Health Organization for COVID-19. Thanks so much for being with us today, Dr. Diaz.
Thanks, Nika. Happy to be here.
So the reason we wanted to do this topic today, I'm sure a lot of you are either in India or have heard about the situation in India and some other countries, such as Nepal, Turkey, Argentina, where the health system may be overwhelmed with the number of patients and people are having to think more and realistically having to take care of somebody who's sick at home with COVID. So we wanted to talk about what you can do, what you shouldn't do, and when the person really needs to seek care in a hospital, when someone's so sick that they need to seek care. If you have questions for us, use hashtag AskWHO if you're on Twitter. On the other social media channels, put a question in the comment section and our social media team will be looking through those questions and pulling them up and sending them to me. I'll be looking at my phone to see those questions, so you'll see me looking down once in a while. Dr. Diaz and I are not wearing masks because we're in a space that's very well ventilated. It's actually even a little cool. There's so much air circulating and we're more than a meter apart. If we were closer together, if there wasn't good ventilation, we would be wearing masks as per WHO recommendations. So I guess the most important question off the top, Dr. Diaz, is it possible to care for somebody with COVID-19 at home?
Thanks, Nika, for the question. Yes, it is possible to care for someone with COVID-19 at home. I want to be very clear with this. The majority of people who get COVID-19 develop mild symptoms. So it's only, we don't know the true estimate, but around, let's say, 15% of people who develop symptoms with COVID-19 that develop severe or critical COVID-19, which means people that really need to go to the hospital, be treated with oxygen therapy and other interventions that usually can only be provided in a healthcare facility.
So to flip it around then, about 85% of people, or 5 out of 6 people, will have milder symptoms and can stay home, can be cared for. So they actually are sick, they actually have COVID-19, they test positive, but they can actually stay at home.
Yeah, the majority of people can stay at home. Now, the most important though, if you're going to be staying at home when you have mild COVID-19, is that you don't infect other people. Right, so this is an infectious disease. We have seen the numbers increase, especially if you're not, doing the right infection prevention and control measures.
We're not able to for some reason.
Yeah, so if those aren't in place, then you can spread the disease. So if you're being cared for at home, the important thing is don't infect others that are maybe living in your same house or area.
So what's some advice, and we're going to switch back and forth a little bit between the advice for the patient, if you're the patient, or the advice for the caregiver if you're caring for somebody who's sick in the household. So if you're caring for someone who's sick at home, we'll get to the kind of sort of medical care you can provide to them, but how do you prevent yourself from catching the virus from this person that you're very close to and taking care of very intimately?
Okay, so I think it's important, let's say you're going to be caring for your family member or your friend who has COVID-19 at the house. So the important thing is to protect yourself, which means you can be in close vicinity, but if you're close, within 1 meter distance, then you have to wear a mask. Also, the person with COVID-19 should be wearing a mask, so then you both protect yourselves. When you're providing direct care, you can wear PPE, so that means the personal protective equipment, such as the gloves and the gown. You have to wash your hands before and after you may have contact with the patient with COVID-19. And so that's how you also make sure there's enough airflow in the room. Right, so ensure that if it's possible to open up the windows, ensure there's good airflow, good ventilation. That will also help reduce the risk of having the spread of COVID-19.
We have some guidance on if you look on Twitter, we have some advice for people for how to prevent catching COVID if you're caring for someone at home. There's at least 10 steps. I'll just read off a few of them. So on top of what Dr. Diaz has mentioned before, it's best if the person who's sick can be kept in another room or another space if you have enough space for another room, do that. Otherwise, at least further from everybody else. Designate one caregiver. If there's many people in the family, it's best if one person becomes the specialist in caring for the person who's sick, and they can be the one who's very conscious of all the measures they need to take. Dr. Diaz mentioned wearing a medical mask. That's for the caregiver and for the person who's sick. The person who's sick doesn't have to wear the medical mask when the other people are not around them. Presumably when they're alone in the room, they don't have to be wearing a mask, right? Especially if they're finding it's hard to take a full breath. Frequent hand washing is very important. Using separate dishes, linens, and towels for the patient and for the rest of the family, and disinfecting surfaces regularly. And also how you dispose of the waste, the masks once they're used, and so on. So this is just a rough overview, but there's more information that you can find on WHO's website and other sources as well. So you were saying earlier that people with mild disease can be treated at home. So who is under that category of mild disease? What are some of those symptoms that a person starting to fall sick with COVID-19 will feel?
So there could be various symptoms, such as fever. So fever is one of the common symptoms. Someone can have cough, so a respiratory symptom such as cough or sore throat, perhaps feeling a little bit of fatigue, right? Just feeling a little bit ill. You know, some people may call it like an influenza-like illness or like a viral infection, because it is a virus.
You feel like you have a flu.
You feel like you have the flu.
You feel unwell, basically.
You know, one of the symptoms that's more, has been more specific means that we've seen a little bit more with COVID-19 rather than with other viral respiratory infections is the loss of taste and the loss of smell. So that's another symptom that people may experience.
So that's a sign that you maybe need to be tested and also need to isolate yourself. So we have a few questions coming in. And this is a thing we're going to be very conscious of today. There's some of the drugs that we will talk about that are useful for treating COVID, but need to be used by a health worker in a healthcare setting. So we will be very clear when we talk about the things that can be used at home and the ones that are best used under medical supervision. So this was a question on Facebook, is what are the drugs that can be used that are officially recommended for use in treating COVID-19?
Okay, so for the treatment of COVID-19, the official WHO recommendations at this moment in time are just for one drug. We have one strong recommendation for the use of corticosteroids. So those are can be taken by oral form or through an IV if you're in the hospital, but they are only indicated for patients who have severe or critical COVID-19. So that means patients who are on oxygen therapy, who have pneumonia, significant enough pneumonia where they need oxygen, or who are in the intensive care unit. So that is the one recommendation. We have looked at the data on other drugs very carefully, and you can find those on the website. And at this moment in time, we have recommendations strongly against the use of hydroxychloroquine, so really no benefit in either mild disease or in the more advanced disease. Against lopinavir, ritonavir, again, no benefit in mild or severe disease. We have a recommendation also against ivermectin, but that one's written a little bit different because it can still be used in clinical trials. It's just that the data wasn't enough to say it works. We don't know. We don't think it should be used outside of clinical trials, so we'd still need to gather more evidence before we know if it works or not works. And then we also have a recommendation, a conditional recommendation against remdesivir. Now that one was conditional because there was two conflicting trials. One trial that really showed no mortality, and another one that said maybe there is some benefit in some patients, but when we looked at the data in totality, it looked like there was no benefit for mortality in patients. That's why we said conditional not to use, and are awaiting more data to come up on this drug to see if we need to adjust that recommendation.
So to get back to what you said off the top, though, the one recommended drug, which is recommended because all the trials and the patients who are part of trials, the results show that this worked in people who were very sick and were in hospital. This worked to prevent them getting even sicker and to prevent them from dying. That one was dexamethasone, or a corticosteroid. But you said that's only useful in a clinical setting? Why do we not advise people take it preventively or if they have mild disease?
So when we looked at all the evidence from the trials, we actually looked at the different subgroups. We always do that. We look at the subgroup of mild patients and the subgroup of severe and critical because they are a little bit different. We already discussed there's many mild patients who do not go on to develop severe or critical. When we looked at the group that was mild, that got treated with the corticosteroids or dexamethasone, there was actually a concern that it could increase the poor outcome, increase mortality. So there was a slight concern of that. So that's why we say no benefit for patients who have mild disease. It does not prevent progression of disease to severe or critical. So only its use in the more advanced disease.
I know it's a lot of information to take in this way, so you can also look on WHO's website for more detailed information on dexamethasone, how that conclusion was reached, and why we have that recommendation. So someone's asking on LinkedIn, how can you recommend that people stay at home? Most patients end up in the ICU with low oxygen and with pneumonia. Can you just clarify on that?
Again, the numbers we have from multiple large studies and the surveillance studies from different countries show that the majority of patients don't go on to develop severe critical disease. They 80%, I think 85% have mild disease, and we also know some patients are asymptomatic. So, so that is what we know. So a small percentage may go on to severe disease. We also know the risk factors that put people at higher risk for severe disease. And that owes older age, people with chronic conditions such as hypertension, diabetes, chronic neurological conditions, immunosuppressed conditions such as malignancies. So we do know there's a group that is at higher risk for death and for developing severe disease or complications. That being said, obesity also in that risk factor. That being said, we do know, unfortunately, there are younger people that can get sick and can get very sick. So that's been documented, but it's not common in that age group.
So I'm going to split this into two questions. All those people you listed, elderly people, people with obesity, and so on, who are riskier of getting more severe COVID, if they have it, do they need to consider going to care earlier than somebody else might?
Of course. I think if you are someone who has a chronic condition like I just described, or an older person, and you develop COVID-19, or then yes, you have to monitor yourself very closely. In some health systems, if the health system allowed, it would be an admission to the hospital for close monitoring and supervision under medical care. In other systems, where the choice is for you to stay at home, then you would still have close contact with your healthcare provider, asking every day or twice a day, are you having any troubles with shortness of breath? Are you having any troubles with chest pain? To see if there's something that needs to come into the hospital sooner. And now we use the home pulse oximeter. So these patients, let's say you are going to be managed at home and you're older, or you have high blood pressure, then your doctor, your clinician can say, here's a pulse oximeter. They can show you how to use it. It's a finger tip device, and instruct you how to monitor your own oxygen levels. And so if the oxygen level starts to fall, then you can alert your doctor immediately and get the right care.
Okay, so this question is related to that as well. How long should a person be cared for at home? What are the signs that somebody actually isn't an ideal candidate for home care and needs to go seek care? You mentioned a little bit for some of those risk groups, but what about for the general population? What are the at-risk signs that say, now this is no longer someone who can be treated at home and we need to escalate?
So it's a very important question, and all people should know this, the warning signs for progression of disease. And what we have seen is that from the onset of symptoms, sometimes people start to progress day 5, day 6, day 7. So even though you may be okay for the first 3 days, you should still monitor your symptoms out closely over a week, 7 days. So that's one thing to be important. So you monitor every day.
Because you might start thinking I'm so lucky, I got a super mild case, it's 3 days in, I'm fine, yeah. I can, start to reduce measures and so on. But you're saying you actually have to pay close attention as the
Yeah.
days go on even.
As the days goes on, I would say, for 1 week from the symptom onset to make sure that, you're not developing any complications. Now, what do you watch out for? One is shortness of breath, so that's trouble breathing. And especially warning signs, trouble breathing, is you're trouble breathing just at rest, like you're just sitting there and you can't catch your breath. Or you're speaking and you can't finish your sentences because you feel like you have to catch your breath. So that's a warning sign that needs help. The other can be chest pain, like you have pain in your chest, or when you take a deep breath, it hurts in your chest. That can also be a warning sign. The others could be fast breathing. I'm not sure, maybe people aren't used to counting their breaths. But if you feel, again, fast breathing, your heart is racing too fast, again, that's a warning sign. Change in mental status. This is one that sometimes people don't, we think about the respiratory stuff a lot, the breathing. But actually, the brain function, if you get confused, if you get very sleepy, you're hard to wake up, those are things that can also be warning signs.
No, that's more for a caregiver, because it'd be hard for you yourself to realize that you've changed mental state or that you're having trouble waking up, right?
Because you may not realize what's happening.
Yeah.
But if your caregiver starts to see you acting differently,
Yeah.
not the way you usually act, that is a warning sign. And then there's the any emergency signs, such as complete absence of breathing, going into a state where you're unresponsive. Again, this would be your caregiver seeing you all of a sudden having severe distress.
Yeah.
Of course, those are more obvious signs for the call for help.
So those are important signs, and those ones you can also follow national guidance. For example, we've been looking recently at the advice that the Ministry of Health in India has provided people, so people can go look there and see what kind of signs are the warning signs that staying at home is not safe for this particular patient or for you, and you need to seek medical care. What about fever? This person is asking whether or not you treat a fever with a steroid. And you said earlier that there's no treatment we recommend aside from the steroid, but I think we could slightly nuance that, because you can take medicine to control your fever if you're at home and you're having a fever.
Sure. So there are symptomatic treatments. So treating a fever is good because a fever can be uncomfortable, right? And bothersome. So a symptomatic treatment for a fever is something to reduce the fever, such as paracetamol. It's commonly used, and that is safe to use in COVID-19. So it is a recommendation out there. It's not one of those therapeutics that treats the virus or the body's response to the virus, but it can reduce the fever, and that's okay.
What's a fever that's a danger sign? At what level is a fever a danger sign?
The fever, fever is a common symptom in COVID-19. So it's not necessarily a danger sign, and like the other danger signs I described, right? That are danger signs to call for help, contact your health provider, maybe call an ambulance if it's an emergency sign. So a fever is not a danger sign in that way. It is a common symptom with COVID-19. Now, if the fever persists for many days, again, we're watching, if you take the paracetamol, if you take paracetamol that reduces the fever, then you would expect the fever to go away. And then maybe the fever comes back after the drug goes away and you take another dose. But if you notice that the fever continues or isn't getting better with the paracetamol, and it's, again, day 5, day 6, day 7, where the fever is persisting or even getting higher, 38 degrees Celsius is what we record as fever. So if it's persistent and really not responding to the paracetamol after 3 days, 4 days, 5 days, then that's also a warning sign at that point to call for your doctor, call for help, see if there's something else that's going on that needs to be treated.
We also should remind people, I think, that if they're taking medicine to treat something else they have, that they can continue that medicine, right?
Of course, I think, again, if you're, and this is the group of patients that may have chronic conditions, like someone who has diabetes or has high blood pressure, and you need to take those medicines. Continue with those medicines if you have COVID-19, mild COVID-19. If you have any concerns about whether or not you should be taking your medicines, you do need to call your pharmacist, call your medical doctor, discuss it with them before you stop.
Now, antibiotics, that's one of those medicines that people tend to think will help them with COVID. It's something we reach for a lot. are antibiotics effective or useful in treating COVID?
No. So I think we have to be very clear with that message, that antibiotics are for bacteria, and are not effective for COVID-19, which is from a virus. So I think that's clear. That's very clear. So for patients, if you're at home and you have mild COVID-19, then we don't recommend the use of antibiotics. So I think that's clear. I'm going to have a however here.
Yes.
However, your doctor, your clinician, who's ever, the person who's caring for you, if they suspect you may have a bacterial infection on top of COVID-19, now for mild disease that would be very atypical, and even for severe and critical disease, it seems like it's not common to have both virus and bacteria. But if your doctor thought that you may, then you could be prescribed antibiotics. The same thing goes, let's say you live in a place where there's malaria or dengue or another infection that is endemic or common in the area. If you develop a fever, your healthcare provider may consider to test and treat you for malaria and COVID-19, because those co-infections can exist. We don't know how often they occur, but if you're in an area where that happens, then those protocols should be followed.
Just want to take a moment to remind people, if you're following us on Twitter, use hashtag AskWHO to ask us a question. That's what we always use. If you're on any of the other social media platforms, wherever you're watching this, you can drop a question in the comments. So on LinkedIn, somebody has said, people need oxygen. Can we talk about this? But it's not everyone who needs oxygen. So can you talk a little bit about who does and who doesn't need oxygen? There's a lot of talk about oxygen. WHO is sending oxygen concentrators to India, and you've been very much involved in helping countries increase their supply of oxygen because it's a hugely important treatment. So who needs it? Who needs it and who doesn't need oxygen?
So going back to the very beginning, the majority of patients do not need oxygen. So if you have mild disease, or even if you have moderate disease like a pneumonia from COVID-19, but not a severe pneumonia, then you won't need oxygen.
Or should we say the majority of people with mild disease won't need it? If you're in a clinical setting, there might be a larger percentage of people who do need
Exactly.
it, right? Okay.
So this 15%, if we're using that kind of estimate number right now, to go into the severe and critical disease subset, then those patients need oxygen. So is that clear? So not everyone needs oxygen. Mild patients do not need oxygen. Moderate patients, that means pneumonia that's not severe, do not need oxygen. But those that progress to severe pneumonia, critical COVID-19, those patients need oxygen.
So you were talking earlier about an oximeter. So this is something that registers your oxygen level. When is a warning sign that the person is low on oxygen and would need oxygen, would need supplemental oxygen? We're all breathing oxygen now, but who would need supplemental oxygen?
Exactly. So I think this is really important. So oxygen, supplemental oxygen means just giving you medical oxygen to get your oxygen saturation levels in the blood higher. Mm-hmm. So we use these numbers, and again, I'm going to give you estimate numbers. A normal oxygen saturation is about 98%, right? So that's a normal number. A dangerous number, where we prescribe oxygen on a regular basis, is less than 90%. Okay?
Yes.
So that's clear. There is a gray area between 90 and 94. Okay, so medicine is like this, they're sometimes gray. So 90 to 94 may be someone who's on the way down, it's starting to get low. Maybe they started 98, then they went to 94, and now they're 92, so we know that person is getting worse. So then we would probably start oxygen if they were in the hospital. However, let's say some people started at 94 and they're staying at 94 and it doesn't look like they're getting any worse, so that patient may not need oxygen. So there is a gray area, and that's why it is important, if you have an acute pneumonia like COVID-19, that's complicated, that you get medical care. The clinicians, your doctor or your nurse, is skilled in doing an assessment, a clinical assessment. So it's not just one number. They'll look at how fast you're breathing. They'll look at how you're thinking, how clear your mind is. They'll look at other signs and decide how much, does this patient need oxygen, and then give you the right number of oxygen. So oxygen is a medicine, right? It's titrated, it's a dose. Just like you take a pill that has a dose of this, this milligrams period. Oxygen as well is a dose. So we have different doses of oxygen needed to give to the patient to treat them appropriately.
So that's why WHO doesn't advise people use or take oxygen at home, because it is actually something that needs to be given with great care in order for it to do no harm, in order for it to be helpful. Is that right?
And this is key, and I want to be clear with this. Home oxygen is used for chronic conditions. For example, some people out there may have chronic COPD, chronic obstructive pulmonary disease, and they have been prescribed home oxygen at low levels of oxygen. And that happens. For acute COVID-19, it's a different story, because what I've just described to you is a person who progresses in getting worse. And so maybe at the beginning, the person with COVID-19 who's developing more severe symptoms needs a low level of oxygen. But it's unfortunately common then that they need more oxygen and more oxygen. And so you titrate higher and higher and higher, and eventually may need a ventilator or something like that. All that titration is best done under medical supervision, because it has to be done carefully, the right dose for the right patient to get to the right targets.
It's understandable, though, and we've seen very distressing scenes of people not able to access healthcare and scrambling to find oxygen for use at home as well. So we understand that situation can occur.
Yeah, no, and I think it is a challenge. When the number of infections in a country rise exponentially, as we've seen, so you're going up the curve. So there's a lot of patients then, a lot of people who have COVID-19, and so even this 15%, which is, it's a small proportion of the entire group, will progress to need oxygen, and that can overtake the health system. So the health system is trying to do its best. They'll make more beds, right? They'll have referral pathways to other hospitals to take care of patients. They will reduce elective surgeries, right? They will reduce the care of elective surgeries to open up more space for COVID-19 patients. But and they'll start to do more home care, right? Home care as part of the care package.
So meaning supervising from like a community worker or a doctor or community nurse would be able to supervise some patients from afar. So they're not admitted into the hospital, but they're still receiving some kind of medical supervision.
Yeah, and those home care, remote care, care pathways are good. Now, if you integrate oxygen into the home care pathway, that has to be done very carefully for the reasons I've already described.
Skipping to another topic here, this is a question on Facebook from Laura Bahina, who's asking, are there any studies on how any specific nutrients or water can help make COVID symptoms more tolerable?
What we recommend is to eat what you would like to eat, try to maintain your nourishment, and to drink and stay hydrated. We don't want you to get dehydrated. With the fevers, people can get more dehydrated. If you're feeling sick, you may not want to eat, you may not want to drink, but we do encourage people to continue, maintaining their hydration, maintaining their nutrition. Take a rest if you're feeling sick, right? It's okay to rest. But once you're ready, resume activities. Don't stay immobile in bed. Resume activities slowly at the pace that works for you when the time is right.
Okay. This one goes back, it's still on topic for oxygen, and a couple of people are asking. On Facebook, Naveen Chatra is asking, when is a ventilator required in a hospital? And on LinkedIn, there's a question, what is the role of ventilators? And I know in this emergency, I also learned that there's a difference between having an oxygen mask put on you and a ventilator, which is a whole other step. So can you clarify a little bit for us?
Sure. So again, just to kind of go with the same theme here, if we think about 15% of patients may need oxygen, right, support, of those, it's a small proportion that go on to need ventilation. So I think, now ventilation, what is ventilation? Ventilation is when we have to give you higher flows of oxygen and some pressure to help you breathe.
Like pushing the oxygen in a way?
Yeah, so it's two things. It's higher flows of oxygen, so higher concentrations of oxygen, and pressure, meaning that it helps you with the work of breathing, because some people can get so short of breath and have such difficulty breathing that they can no longer really continue to breathe on their own anymore. It's like running a marathon and you cannot breathe because your muscles of breathing are tired. And so the machines, what they do, the ventilators, and what they do is reduce that work of breathing. So all of a sudden you take a deep breath and the machine gives you pressure, and that makes the breathing easier. And that allows your lungs to heal, so that extra pressure. So that's when the ventilator is necessary when you develop in medical terms, we call it respiratory failure. The breathing, you are no longer able to sustain the breathing without a machine. Oxygen on itself, like you said, supplemental oxygen, we can give just regular, kind of lower flow levels of oxygen, lower concentrations, but enough to get the oxygen level to where we need it. And that's what we always start with. So we don't go to ventilation unless there is a true emergency sign that needs it right away, or the progression of the patient to that condition.
Thank you for that. So our colleague Walter, who's scanning a lot of social media questions, he says that there's a lot of questions on various remedies such as inhaling hot water, drinking lime water with ginger. Somebody else was asking about exercises. Are any of these, is there research behind any of these showing that they are useful, or how and when should a person drink water with lime and ginger and so on? I think you know what I'm saying. There's a lot of ideas for home treatments. Do any of those have science behind them, and do we recommend them in some way?
It's a good question. There's many home remedies, as you're describing, or other herbal medicines. We do not have any data that I'm aware of that shows that drinking such home remedies reduces the risk of progressing the worsening of COVID-19. So there's no data. But I also want to acknowledge not all of these things are studied in clinical trials. If drinking a hot glass of tea makes you feel better, then that's okay. I think during this time when you're sick, taking in things that help you, symptomatically feel better is good, and staying hydrated is important. And eating a good, well-balanced, as much as you can eat, based on your appetite, is important to maintain your nutrition.
So those things that there's no science or research that shows they work, but if you love to drink honey and ginger and lemon because that's what your parents always prepared for you when you're little, and it makes you feel better and it helps you feel more comfortable, then yes, right? There's no reason not to do it.
Yeah, no, there's no reason not to do it. I think if it helps you feel better. Again, these are don't do anything in excess, I guess. These are, like I said, if you need a glass of tea, if you need whatever it is, water, bubbly water, whatever makes you feel a little bit better while you're sick, then or chicken soup, then that's what you should take. But again, there is no data to show that it's going to reduce your risk of severe disease. Don't take anything in excess. The supplements of vitamins, those things have not been shown at this moment in time to be to reduce the progression to severe COVID-19. So we don't have recommendations for those.
You spoke a little bit about comfort just there, and I know before we started we talked about this. What are some of the psychological or mental things that a caregiver can do to make a person feel better? Because it's very scary when you think you have COVID, if you get that test back that says you do have it, it can be a very scary time. So what can be done to make people feel better?
I think it's extremely important to listen to the person, your loved one can feel fear, can feel anxiety, maybe feels sad. You know, that amounted on the fact that we've been living in a pandemic for over a year now. So the other aspects of that have impacted people's lives. So I think it is to listen, and to listen to the fears, to listen to the concerns, and be there for that person. I think that's the best that we can do, but to acknowledge that it's important to discuss, if the person wants to talk about their feelings.
And let's acknowledge it's normal that people would feel anxious. This is a disease that's been in the news. There are some people who get very sick and you can die. So it is something to be taken seriously. And I think I would suggest that people do research as well. If you're fine, even if you're not sick and you're not treating someone who's sick, it's helpful to listen to something like this and do a little bit of research so that you're ready should you need to take care of yourself or someone around you. And here's this question from Snehil Singh, who's asking, if you live alone, how can you treat yourself at home? What would you do if you were alone and unable to reach anybody? How would you take care of yourself at home?
Well, for those of you that are alone who have COVID-19, I think the same things, you have to self-monitor yourself. So we discuss those things, right? You monitor for the warning signs, you make sure you eat, you stay hydrated, you take a rest, but then start to resume activity. So all the same things apply. But I would say you do have to have help numbers, right? The access, who are you going to call for help? And those includes both either, friends, social contacts, non-physician people, the people, your support system. So identify someone that can be there for you.
And check in on you.
And check in on you. And then also have your medical contacts, right? So what is the health system contact you have? And don't wait too late. If you're worried about something, I would suggest call early, because you want to get advice early because you are alone. And so maybe there's not someone there that's going to be watching you so closely. So call for help early, get good medical advice, make sure you know where to go if you have worsening symptoms or if you have an emergency sign, what's the ambulance, how to access care. And with that, I think it should be okay.
And let's go over again when it's not okay. So can you just go over, you read them earlier, but maybe some people have joined us later. What are the signs, what are the symptoms that are red flags that say you need to seek care and follow your government advice on how you should seek that care?
So again, monitor your symptoms every day, and again, the first 7 days are probably the most important time. Look for shortness of breath, difficulty breathing. The warning with the difficulty breathing, again, is if your difficulty is breathing when you're resting. Let's say I'm just sitting here and I can't breathe. Or if I'm talking and I can't finish a sentence, like you can't speak normally because you can't breathe. That's a warning sign. Chest pain, any pain in your chest, either during breathing or during activities, that's a warning sign. One that we forget is the change in mental status. And again, you may not realize that you're getting confused. But if your caregiver or your family member sees that you're getting confused, you're more sleepy than normal, if you have a seizure, these are warning signs. Any evidence of real trouble breathing is a warning sign. I'm looking through my list because I don't want to miss one of the important ones. What else can I say? Some people, when they have a lot of shortness of breath, you usually would notice their lips turn blue, and that's a sign of low oxygen. So that's an advanced sign. So you don't really want to wait till your lips turn blue. So once you start to feel shortness of breath at rest, then I think you call for help.
There's a couple of questions on positioning. On Facebook, Janet Blow is saying, is there any truth to the rumor that sitting up and moving around is more beneficial than lying down? And there's also some discussion of positioning. Should you lie on your back? Should you lie on your front? Should you sit? Should you lie down? What does WHO advise around how you should position yourself or your patient that you're caring for at home?
So I think patients should try to find a position that's comfortable for them. That's most important, because you're sick and you want to be in a comfortable position. So don't force yourself into positions that aren't comfortable when you're at home. And again, we don't want you, when you're taking a rest, and maybe you're in bed, we don't want you to stay immobile in bed, for many days on days, because that's not necessarily good. So making sure that you are doing some activity, maybe not the normal activity because you're sick, right? So you can't do everything you usually do, but you resume some activity at a pace where you feel comfortable. The ideas with positioning sometimes come about when patients have pneumonia. Okay, so this is it's a particular group of patients who have pneumonia. That means the lung is infected with the virus.
It's not every person with COVID will have pneumonia.
No, because the mild patients don't have pneumonia. So the majority of patients don't have pneumonia. But there are some people who develop pneumonia. And if you have pneumonia, we said some of them don't need oxygen and some of them do. Mm-hmm. So the idea with breathing exercises, with positioning, allowing your lungs to expand is a good idea in the sense, right? Because when your lungs are a little bit sick, not all areas of the lung may be ventilated and open. So then doing some breathing exercises can help open up some of the lungs that are sick. There is, in the hospital setting, we do recommend some patients who have severe pneumonia and are on oxygen and on even the ventilator support, that they go on their abdomen, that they lie on their stomach. And the reason we do that is similar to what I just said. It's because their lungs are so sick that we want to kind of open up new areas of lung. And so when you lie on your stomach, you actually can open up the bases of your lung. And that helps with patients who have severe pneumonia. And it helps with their oxygen levels. So that is something we do in the hospital under medical care.
Okay. On Facebook, Sahil Dewan wants to know who we're speaking with. So I'm sorry I haven't reintroduced you, Dr. Diaz. Dr. Janet Diaz is the lead for clinical care for COVID-19 at the World Health Organization headquarters, which means she and the team she works with are, from the beginning, have been learning about everything we know, all the doctors and the researchers who are working on COVID, gathering all that information, formalizing it, and sharing it with the rest of the world. Is that a good summary of what you've been doing?
It is a good summary. And also I'm going to add, I'm actually a respiratory specialist and an intensive care specialist.
So this is your field.
So this is my field.
This is your area. I know we've worked a lot together in Ebola. You're not by training then an Ebola specialist, but you are absolutely 100% a specialist in this area, which doesn't mean she's not a specialist in Ebola care, which she is. Let's go back to oxygen at home. We had another question saying, somebody saying that they have low oxygen. So what should they do? Can you just recap on what you had said on oxygen?
If someone
levels.
has low oxygen, the
That's
levels?
Right. Yeah. This person says I have low oxygen. What should I do?
So if you have low oxygen or any of these warning signs, then you should call for help. So having low oxygen levels can be a life-threatening condition, right? And so the immediate treatment for low oxygen levels or for any other emergency sign is oxygen therapy or making sure you're breathing okay. So it's hard for me to say to this person what's going on. But if they are concerned about their oxygen levels right now, then you must call your clinician, call the pathways in order to get sure that you get the right medical care.
Can you just recap what I know you touched on it already, but the zone under which, if you're lucky enough to have an oximeter at home, what's the level at which you should be concerned and should reach out to your healthcare provider?
So remember, the oximeter there are very easy to use oximeters, but always use them according to the right directions. And it's always good that your clinician or your pharmacist has shown you how to use it so you use it correctly, so you get the right numbers. So the number is accurate, right? So it's true. Because you don't want to get worried if you don't need to be worried because you didn't use the device right. And also you don't want to be reassured if you didn't use the device right. So using the device right is really key. Normal oxygen level in someone with normal lungs is about 98%, more or less. Now, if your oxygen is below 90% and it's a true number, then that's a danger sign. So that means you need to call immediately for emergency help. So ambulance service, the COVID care pathway, whatever the national protocol says, in order to get immediate evaluation. There is a gray range between 90 and 94. Now that means if you are between 90 and 94, that can be a sign that you're getting worse. Because let's say you normally are 98% and all of a sudden you're 94, you don't necessarily need oxygen, but it does show that your number's getting worse. And then let's say it goes to 92%. Again, it's dropping, so that's a warning sign for us. It means that you need to probably get started on oxygen therapy because you're on the downward. So that is how we are, that is the numbers that we kind of use to guide. And again, it's not just one number. The clinicians that are caring for you, the nurses, we look at the whole picture. We look at you completely, not just one number from the oxygen. We look at your breathing, your thinking, the whole picture in order to make the best treatment decisions.
Elderly or you have obesity or the other conditions we spoke
Chronic lung
about.
disease, chronic heart disease. There's all sorts of things we're looking, taking in to make the clinical assessment.
We're going to wrap up in a few minutes, but I just want to just recap again. So today we're talking with Dr. Janet Diaz, who's the head of clinical care for COVID-19 here at the World Health Organization. And today we're talking about how to care for someone else or yourself sick with COVID at home. We have a question from Pabitra Barman, who's asking what kind of healthcare is recommended when the patient is recovering from COVID. So this is someone who's doing really well. They've gotten through the worst of it, and now they're coming through on the other side.
It's a great question. It's a really important time when you're recovering from COVID. So hopefully you didn't get too sick or you didn't spend too much time in the hospital. You could have been at home potentially. So I think it's just to try to resume your normal activities. Don't push yourself too much. You don't want to kind of get yourself too tired and fatigued. People have been reporting prolonged symptoms. Not to say they won't ever go away, but the symptoms that may last 6 weeks, 1 month, 6 weeks, 2 months, 3 months, different kinds of symptoms. So so I think you have to watch yourself, resume normal activities at the pace that works for you, hopefully be able to go back to work and do your normal things. However, if you notice that some of these symptoms persist, or they aren't getting better anymore, they got better, but then they stopped getting better, or they got better and then they came back again, right? So you were feeling good, and then all of a sudden the fatigue hit. You were feeling good, or all of a sudden you were having insomnia. So these are things to monitor. Right now we're starting to learn more about the post-COVID-19 condition, as some call long COVID. We still don't know enough about it. We don't know how many people will be affected by it, how long it will last. But nonetheless, if you do feel those symptoms, then tell your provider, again, tell your healthcare provider. There are care systems now that should be in place in different health systems in order to make sure that you get the right care if you develop symptoms that are more protracted or relapsing in the time after the acute COVID episode.
So Dr. Diaz, you're actually working on this. You spoke about what we don't know yet, but WHO has a process in place where we're also gathering information with patient groups and with doctors and the health systems that have seen patients with this long COVID. Can you just add a little bit on how WHO is aggregating all that information and learning about what people are facing and what we can do for them?
So WHO has done quite a bit of work with this, and I think you've just described it. We're working with the patient advocacy groups, we're working with patient-led research groups, and working with academics and other public health agencies that are involved in accelerating our understanding of what this is. We held a webinar in February. The meeting report, out of interest, if you would like to see it, is on the website. And you can really see the types of discussions that we've had, the types of descriptions that have been from different parts of the world on how this is, what are some of the longer term or medium long-term sequelae that are being observed. We will have another meeting upcoming soon. The date yet to be determined in June. Again, it will be an open meeting to really just to continue to expand the dialogue around what post-COVID condition or long COVID is and how can we either prevent it, hopefully, and or treat it in a multidisciplinary way. So I think it will be multifaceted. It will include probably rehabilitation services, psychological care, and then potentially specialty care, depending if it's, cardiac complications or respiratory complications that you may need to see a specialist. So it'll be a coordinated kind of multidisciplinary care package depending on what the symptoms or the limitations patients have in the longer term.
A question from LinkedIn. Will WHO be releasing guidance on home care for patients with moderate or mild symptoms, as we've been talking about here?
So, we do have guidelines on home care for patients. It is heavily focused on the infection prevention and control aspects to avoid further transmission. And there are small sections in there about actually the clinical care. We're also right now developing some very easy to read home care clinical packages, which can really say a little bit more of a step-by-step approach on how to manage patients at home or how to self-manage how to manage yourself if you're sick at home. So we are working on those kind of more simpler tools to complement the guidance that's already online.
And that guidance you were just mentioning there on how to prevent yourself from getting sick if you're caring from someone who's sick with COVID in your home, that's already out in a few different ways. We did a Science in 5 on that topic, so you can find that information on our social media platforms as well. So I think we're going to be wrapping up soon. Do you want to just recap again the statistics on, since this was about caring for someone sick or caring for yourself at home, who can stay home? Who should be fine to stay home and manage themselves or manage, if you have someone in your family who's sick, what are the signs that you can stay home and be managed at home?
So again, I think the estimate numbers we're using, about 85% of patients, have somewhat mild COVID-19.
This is across the world.
Across the world.
This is what we've learned from the very beginning, even the statistics that we first saw from China. I remember in February last year, this was basically the breakdown.
Yeah, so I think we're kind of at the same numbers all across the world, So the vast majority of patients, and then there's also patients who are asymptomatic, and we don't have a clear number of how many of those there are. So the majority of patients have mild disease. And most of patients with mild disease can be cared for at home. So I think that should be clear. There are some patients with mild disease that may preferentially be cared for in a facility. And this is, again, up to national protocols. If a government and the national system wants to keep everyone in a facility to prevent transmission, because they think going home will increase the transmission if the infection prevention and control measures are in place, then that decision can be made and patients can be treated in a community facility just for reducing transmission. Other national plans may say, actually, the patients who are at risk groups, so the patients who are older, the patients who have chronic conditions, maybe we want to keep them in a health facility because we want to closely monitor them because they're at higher risk. So that's a decision. Or, if they're stayed at home, then we're going to keep a closer eye on them while they're at home. So we're going to do extra remote support, our health worker visits to the home, the pulse oximeter at home. So the vast majority of patients can be managed at home if we use based on the severity, based on the mild symptoms. However, if you're in the smaller percentage, so the 15% that develops severe pneumonia, that develops more critical COVID-19, and have the symptoms of the shortness of breath, of the chest pain, of changes in mental status, or any other emergency sign. So those patients clearly should be cared for in the hospital.
You talked there a little bit at the beginning, and it reminded me of a subject we need to talk about a bit more. If you are lucky enough to be with the majority of people and have the mild symptoms, it doesn't mean you can go in and out of your home and go grocery shopping, even if you feel ready for it. You really should be, this is where we've used the word isolate, you should be isolated at home, not by yourself, but keeping that distance from other people, even in your household, and staying home until your symptoms have finished, and even, 3 days after the symptoms have ended, then you're truly well and can start rejoining society, as it were. But that's very important, right? That patients be isolated.
That's the most important thing. I think what we are seeing now in the health systems that are overrun because of the upward curve, the steep curve going up with COVID-19 infections, is because this transmission in the community, right? Then people are infecting other people. And so that's what we need to, the first step to stop that is to stop transmission. So that means infected people stop transmission. So if you're mild disease and you're going to stay home and apply all the precautions you already described. So I think, and then of course the public health interventions that we recommend in order to stop or reduce community spread is hugely important, because we don't want to see the hospitals so full.
So do it all, as WHO talks about, do all those things that help control COVID, which is keeping distance from other people. If you are meeting with other people, meet outdoors so that the air can blow away those drops, small and large drops of liquid that could have the virus in them. Wash your hands regularly so you're not picking up virus on a surface. Wear a mask when you can't be distanced from other people, and ensure that the airflow is good. So wear a mask. Just again, we're not wearing masks here because we do have very good airflow, and we're able to distance from each other. When the weather gets better, maybe we'll be doing these live Q&As outside, because that really is a better space. Especially don't be with a group of people in a closed setting with bad airflow. That's where we've seen the virus spreads most easily from person to person. So as we wrap up here, I'm just going to go over the countries where people are watching us, and then I'll come to you, Dr. Diaz, to see if there's any last things you want to remind people about. But this takes a bit of time, so you have time to think. The countries that are following us on LinkedIn, I won't say all of them, but some of them include Nigeria, Brazil, France, Pakistan, Turkey, Indonesia, Tanzania, Yemen, Jordan, Nepal, Canada, Dominican Republic, Saudi Arabia, Austria, Iran, Mauritania, Kenya, and Georgia. And the countries where people have tuned in on Facebook include India, Nepal, Turkey, Colombia, France, Sri Lanka, Bangladesh, Nigeria, Madagascar, Norway, the Philippines, Australia, Argentina, Honduras, Panama, Costa Rica, Romania, Vietnam, Cambodia, and Malawi. Thank you very much for tuning in from all around the world. So, Dr. Diaz, is there any last things that you think people should keep in mind?
So I think the number one thing would be, let's all work together to stop transmission. So the public health interventions, really, that's the most important thing. We want to see the curve go down. We want to stop the rise. So just like you've already described, that is the number one intervention. If you get sick, though, let's say it didn't work, the public health interventions, we couldn't stop the transmission, and you get sick, most people who get sick will have mild disease. So rest assured with that. And then many of you will probably have mild disease and be treated at home, and that's okay. But the important thing is, don't continue to spread the disease, and applying all those infection prevention and controls measures important. But don't be scared, don't be anxious, because the system's in place, and if you develop any warning signs, then call for help. And we do have life-saving medicines for those of you that may develop severe critical disease. The corticosteroids is one, and the oxygen therapy is the second one. But get those under medical care.
So I think what you're saying in a way is, don't be scared, except for when you should be. So you do need to be very conscious, very aware. If it's you or if you're caring for someone, you need to be vigilant and look out for those signs. So it's in two ways. On the one hand, rest assured that for most people, you will be able to manage it yourself at home. However, be your best advisor and be your number one caregiver at home, and make sure you're watching out for those symptoms, that this is not going to be one of the easier cases, and this person needs more care, basically. So thank you very much for that. Today we were speaking with Dr. Janet Diaz. She's the clinical care lead here at WHO. My name is Nika Alexander, and I'm part of the communications team. Thank you for watching. Thank you for the behind the scenes team that makes these Facebook, Twitter, LinkedIn, and YouTube live sessions go so smoothly. And please tune in next time for the next topic. We don't know what it is yet, but please do tune in. Thank you.
Thank you.